WeCare is a healthcare decision support system that
Wait, let's not start there. Let's talk about how people actually behave in a medical emergency.
medical research consistently shows that in cases such as heart attacks, strokes, etc., delayed arrival to the hospital is one of the key reasons of bad treatment.
People don't know how serious something is. They Google, they search, and they hesitate. And that can lose lives. This became very real to us when my mother had a fall at home. My first instinct wasn't action, it was confusion. I started Googling symptoms, asking ChatGPT, and trying to find the number of the closest clinic. But the problem is that the closest clinic might not always have emergency and trauma care.
At that point, we realized we couldn't afford to waste any time. The biggest problem wasn't the treatment, but was the decision making before the treatment. We designed WeCare to answer two simple questions: how urgent is it, and what do I do next?
We use triage principles to assess risk and provide care navigation in times of desperation.
Wait, but you guys are not certified doctors. How do you plan on assessing people at all?
That was one of the biggest problems we faced while designing this app.
What we realized is that we were asking the wrong question. Diagnosis is about identifying a disease, whereas triage is about deciding priority and urgency.
Emergency rooms provide triage before diagnosis. We are trying to replicate them and do nothing more. Technically, we started with free text and used NLP to process it, for which we tried to access many clinical triage datasets. The access was expensive, restricted, and unrealistic for this stage.
So, what we decided to do for our proof of concept was to ground our system on publicly available triage principles and medical guidelines. It's true that Rome wasn't built in one day. When we first started off giving prompts, we realized that something was wrong. Our language understanding was always working, however, our risk assessment didn't.
For example, when we typed trauma with bleeding, it always didn't escalate correctly. It was due to our limited access to the vocabulary. So we decided to add a rule-based logic to get a more accurate output.
Breathing always override everything. Trauma plus bleeding always escalated. It's things like this that we added to our model to make it safer, more explainable, and medically grounded. Moving on to our live demo, we are currently on the third version of our code, and since it is still in development, we currently use a fixed set of latitude and longitudinal coordinates for our location. Now, the user is expected to input symptoms that the patient is facing. So if I put in sudden chest pain with difficulty breathing, you can see that our NLP model extracts signals such as chest pain and difficulty breathing from our red flag symptom list. Our rule-based triage system provides this risk level. Along with that, we have a system that matches the care that is required for the patient, and we provide a list of hospitals. Now, this ranking is based on the distance from the location. We also provide a one-line sentence as to why we are providing this specific hospital. Now, moving on to a few more examples. As you can see, high fever and vomiting from 2 days is considered a medium level risk, and the symptoms that the triage picks up is a possible infection. Now, if I say a mild headache, this is now detected as a low risk. Moving on to growth and scalability of our idea. We have designed WeCare starting with what's working today and expanding into what will work tomorrow. What you've seen till now is just our base system, our free text symptom input, and our NLP based risk assessment. Now, if this works, our idea will stand on its own. But from here, WeCare grows into real world usability. Things like family linking, emergency contacts, and follow-ups. These don't change how the system works, this just changes how the people rely on it. Now, beyond that, the focus then shifts into live hospital databases and doctor feedback loops. Now, what we've shown you today isn't just the full list, it's just the beginning. When someone you needs your help, the decision shouldn't come down to panic, luck, or guesswork. As WeCare grows, possibilities don't end.